Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hi, everybody, and welcome back to another episode. Today we have with us the wonderful Dr. Olivia Ong. I'm so excited to have you here. And Dr. Olivia is also based in Australia, so that's exciting too. Welcome.
Yeah, thanks for having me, Sarah.
Now, tell us about you.
Yeah, I'm a rehab physician. I'm based here in Melbourne, Victoria. And I also not just work in rehabilitation medicine, I also work in pain medicine. That's my main bulk of work. I work in public practice, private practice. And the reason why I've always been very interested in these two particular areas is because of my backstory, which we will probably talk about in this conversation. And also because of the fact outpatient work has always offered some kind of flexibility in my lifestyle. I'm a mom of two young kids. Other than work, looking after kids, I enjoy writing books. In fact, my memoir, Back on My Feet, has just been recently released in Australia. Actually, it's 2 months. It just turned 2 months old last week, so I'm very excited. And I also I do a lot of speaking and running workshops on burnout prevention and management in clinical settings, hospitals, and healthcare organizations. So that's the other main work that I do as well.
Yeah, I love that. If you don't mind sharing, so your book is Back on Your Feet. So can you tell us a little bit about what that story is going to tell us?
Yeah, so Back on My Feet is a story that I've written because I feel that I didn't quite do it do my story justice in a sense that about 20 years ago, as I was walking to work, I was suddenly hit by a car at very high speed in the hospital car park. In
Wow.
fact, the car went out of control and just ran into me, and I sustained a spinal cord injury as a result of that car accident. And it was quite a very stressful journey and also a very eye-opening journey because before my injury, as a lot of probably your listeners can relate, we're always on autopilot, we're busy, medical practitioners, and we get that, we understand that our patients have been through a lot of things, and but we don't really quite get where they're coming from, really get it. Until you become a patient in that healthcare system and you've been through exactly what they've been through, you didn't realize how flawed it can be. Not only flawed, even as a medical practitioner, I was scared a lot. There was so much uncertainty about a spinal cord injury and prognosis. I think the first thing that I really was concerned about was whether I could even walk again. That was my main primary concern because mobility is a huge was in fact was a huge part of my what got me to be very independent, high functioning junior doctor. I was a rehab registrar when the accident happened. So that was my first kind of question that I had for myself and for the diagnosis. And the second question will be like, will I even be able to have children? That's the other thing. Because I didn't know at that time. You just don't know, do you? And then the third thing is I'm very mindful about caregiver burnout. And I was so afraid that my husband, we were just married for 2 years at the time, whether he would leave the marriage. I'll be a bit too much for him to handle, whether he'll leave the marriage and all that. So there were a lot of things going on mentally, but I think physically I was going through a lot of medical trauma and healing, like trauma in the sense that physical trauma. Obviously, I've been hit by a car. I sustained a L1, L2 dislocation of my spine. As a result of that, I had a spinal cord injury because one of the vertebrae, I think it's the L2, was smashed. That's the word smithereens. That's the word smithereen. It was like bone fragments. And all the bone fragments entered the spinal canal and it compressed the corda equina, conus medullaris, and yeah, there's a lot of swelling and hematoma and all that stuff. And that's how the injury happened. So yeah, until that the swelling and healing occurs, it's you don't really quite know where it will lead me or lead in the prognosis. And that kind of went on for a little while, for a couple of months, in fact, until I think for about 3 months after my injury, I was in the rehab hospital. And I celebrated my 29th birthday. I remember that day very clearly. I wrote in the book, so I remember I had to remember that day very clearly. It was like I had my close friends with me from medical school who we maintained a lot of connection and friendship still even after we graduated.
Mm-hmm.
And yeah, and then I had a special little gathering where we cut my birthday cake and all that. And I would, in fact, even though I appeared to be smiling and happy, but inside I was still grieving and it's very sad. It's just one of those things. There's a loss that it cannot be described in words. It's like a deep grief, deep, deep sadness that I think it's more soul level rather than even physical level. But that night of my birthday, my my legs were paralyzed up until I think late that night. The left leg started moving, and that's when I knew, wow, I'm an incomplete. I knew I was an incomplete injury, but I was still paralyzed, so I didn't want to
Mm-hmm.
hold on to any kind of hope. But once the left leg moved, that's when my brain switched on and said, "Yeah, you got to keep going, and you got to keep going and fight strong." And that's what I did. So I just pushed through my rehabilitation in a way that I managed to work with orthoses when I was discharged. I had a clunky KFO, or knee, foot, ankle orthosis for my right leg because that's the whole leg's paralyzed still. Very minimal movement from the hip, but my left leg was quite functional, and I just had a little foot drop, so I just wore a AFO, or what we call ankle foot orthoses. And yeah, if you want to picture what a KFO looks like, do you remember Forrest Gump with that? Yeah, it's like that. It's very clunky. It wasn't pleasant to walk in. It caused a
Right.
lot of back pain
Yeah.
and that kind of thing. So it wasn't pleasant, and I had to use crutches first, and then walking sticks was only later in the US. But crutches was my main form of assistance for me to move around very short
Mm-hmm.
distances because I had to build up my stamina. And I continued focusing on that until a year later. I really wanted to go back to work because I worked really hard to get to second year
Mm-hmm.
rehab registrar. And I just sat my entrance exams to I guess, the specialty just a few months before my injury. I really wanted to get back to the training program and everything. And thankfully, they managed to negotiate work, I guess, some work change modifications
Mm-hmm.
such that they were able to allow me to work part time and at the same time allowed me to still do fulfill my role and everything. They actually hired an extra person to help me with my role, like a full time person plus me. So in fact, they didn't even have to do that. They could just get that full time person to do the whole role. But they wanted to give me a chance to try this return to work. We call it graded return to work in the rehab medicine world. And that's what I did. I had to do it all from the wheelchair. There was a learning curve for myself. And yeah, I was so grateful that I had such a good employer, good boss. In fact, he got a lot of funding and support. And because I'm under the work cover system, because my
Mm-hmm.
accident happened at work. It happened at work. So I'm under the workers' compensation system or workers' work cover system. And yeah, they were very supportive. And they worked together with my employer to make sure I had a smooth return to work transition. But interestingly, I just remember that same year, halfway through my rotation, I, while I was in hospital, I came across some videos. And that time we had YouTube, or YouTube just came out in 2008. And I remember coming across videos from Project Walk Carlsbad, clients uploading videos of them walking with their trainers. I was fascinated and intrigued. I'm like, this doesn't happen in the hospital where I'm going through rehabilitation. In fact, none of this this is two different worlds. And that's when I started going, oh, maybe I should go there. Then I realized I think I really wanted to return to work first to prove a point, or prove to myself I could still do it, and then go to the US later on. But interestingly, later in 2009, halfway through my part time work, one of the people that I went to rehab with was on TV. He had a documentary about him going to California, going through exactly the videos that I watched. He was walking and training with the trainers. And I'm like, I want to do this. And my rotation was coming to an end in a few months anyway. No harm to lose, right? I just emailed them and I got a spot in March, and that's what I did. I just flew to US. Didn't care what was going to happen after that. I just flew to the US and that's it. That's all I cared. And I just wanted to just get back to walking again. Yeah.
Yeah. Wow. Okay. So I'm hearing a lot of trauma, like personal injury and loss of who you were. That's an
Yeah,
incredibly difficult
yeah,
burden as it is. And then this tenacity that I want to return to work. And what better department than a rehabilitation rotation to say, we should be able to ask Dr. Ong, what does she need in order to return to work successfully and put into place accommodations? Because that's what we do. We're rehab.
exactly, exactly. And that's what they did. And I think it it really also depends on the person. Like this Dr. Michael Chu, who's a friend of mine now, of course, and I'm so much older
Mhm.
now. We became friends after that because clearly this is more than beyond what a boss does. This is like what
Yeah,
a true like peer, trusted peer and friend will do.
yeah.
And yeah, I think it also depends on the personality of the boss. I think I just happened to be really fortunate to get someone like Michael on my side, and Work Cover was very supportive. The two of them worked. But I agree
Yeah.
with you that, yeah, as rehab physicians or providers, we should be able to accommodate such return to work arrangements. It is our bread and butter work. So
Hmm.
yeah, so I think kudos to them, and I hope that this will show the people out there who are in a similar situation like me, almost 20 years ago, that they can go back to work, and don't lose hope, don't give up. Yeah,
And an onus on us as those listening who are part of organizations, employers, or part of the team that can say, what do you need? And accommodate for some of those things so that you can have a transition that's successful.
yeah,
So important. Okay, maybe we go now to what you're doing now and how you got there, because you've learned a lot along the way and you've learned a lot about sustainability in medicine and resilience and burnout. Tell us some of that. Where did that come from and what do you do now?
yeah. There was a few obviously learning experiences that I got from my injury. Like when I was in America, I had to learn how to be kinder to myself because there were days where nothing will happen. In fact, I'll be some days I'll be so exhausted and nothing will happen, like progress, and I'll be very
Hmm.
upset with myself. So that's one thing, self-kindness. Secondly, I realized that it is okay for me to actually reach out to other people in a similar situation and be in
Hmm.
a community of like-minded people, meaning fellow spinal cord injury survivors, their caregivers. I think finding a tribe is so important when you've got a serious illness or neurological condition or going through a tough time. I think it's so important to find a tribe, a community that you can tap into and support one another.
Hmm.
That was the second point I learned, and that was one of the main healing factors for me because if I didn't do that, I will not been able to heal quickly in a
Hmm.
way because they offered me so much emotional and mental support, and it was like both sides mutual. Like that sometimes I will give them from a perspective of a doctor because that's still my identity. I never gave it up. It was still within me. And the last thing was mindfulness was a huge part in a sense that when you are relearning to walk again, or which I had to go through, you have to be because I had to learn the basic movements. Think about a baby. They had to crawl, stand up for a few bits, and then they start taking wobbly steps. That's exactly what I had to go through as an adult with a spinal cord injury. Exactly
Hmm.
same things. And I have to focus on that task at hand at that point in time. Cannot be distracted by the future or cannot be distracted and by the past that's already happened. I can't change that, all of that. So I think that's the lesson I learned about mindfulness, how to be focused in the present and now, here and now. So those are the main things I learned. But it's very can be very cognitive, but there was something still quite missing for a little while. I think it's more that this is we call it top down. It was just mindset and coaching myself to go through the whole process of relearning to walk again. I only discovered about what I call bottom up approaches later on when I faced my greatest episode of burnout in 2019. So up to this point, we're talking about 10 years. For 10 years, I pushed through at Project Walk to relearn how to walk. That's 5 hours of training every day for 5 days for 3 years. And then I went back to training in 2013, straight away, well, part-time for 2 years, then back to full-time. And then I had exams. Then I had a child. Then I had more exams because I did a pain fellowship after that. So I don't know why I did that to myself. But anyhow, by the time I reached 2019, where I started being a first year pain physician, like with a really good jobs and good career, I was smashed. I was fried. That were the words
Mm-hmm.
that I could think of how I felt that time. I was so tired, so exhausted. I couldn't get out of bed one day. And of course, initially I thought, is this my spinal cord injury? Because it can happen. Neurological fatigue is very real, like people actually do not get up sometimes. And I'm like,
Yeah.
is this my SCI, as in spinal cord injury, playing up? Then I had it checked out my GP. She's like, no, it's not your SCI, it's you are burnt out. But I don't think even in 2019, there was some awareness of burnout. I think from my US
Mm-hmm.
colleagues, I think a lot of literature and a lot of studies have started to come out from the US by then. But my knowledge of burnout wasn't much either. I know I burnt out, but what is burnout? No one explains to me. And I thought it was just pure exhaustion. Then I realized there's a lot more than that. It's about the nervous system being so dysregulated to that point where you just fried, basically. And so I went on this journey, research, getting people to help me, as in like mentors and coaches and I said mentors, teachers, coaches of different disciplines to help me find my way. It took me a while to figure out that it was mainly the nervous system being dysregulated. So I got to do not just the meditation stuff, because that may not work, which I learned that the hard way, because I was struggling through meditation. Because everyone always tells you to meditate when you're burnt out, but it may not necessarily work the first time. When you're so super dysregulated, you need something else. You need to actually calm the nervous system down. And until I started doing a lot of nervous system work, it's that I was still going through burnout, even though I was back at work, seemingly coping. But I wasn't inside. I wasn't coping at all. In fact, I was crumbling probably. And then we had COVID in 2020. That didn't help. And I was pregnant with my daughter. That didn't help either. So it just went on and on until, only in the past few years, it's when I started integrating top-down and bottom-up approaches in my not just clinical practice, because my patients are dysregulated as well. They've got chronic pain, trauma, and all this. And my coaching clients are dysregulated as well. They are mainly burnt out, like medical people, like doctors, other healthcare professionals who are very burnt out, and they just want to find a way out of it. Because they were where I was in 2019, just going, I don't know what to do. I've tried the breathing stuff, the cold showers, the whatever, the breath work. It didn't work. And I'm like, I went through a similar experience. If I hired a meditation teacher to help me breathe, and it took me like 6 weeks to breathe properly. That's how dysregulated I was in early stages. So I think, there's a lot of research now about bottom-up and top-down approaches to managing a dysregulated nervous system. And a dysregulated nervous system can lead to burnout, can lead to chronic pain, can lead to anxiety, depression, and all those gut issues, brain gut axis disorders and stuff. It really made sense to me as a pain physician once everything clicked, research-wise and knowledge-wise and embodiment practice-wise. I'm like, oh, now it makes sense. Now I can teach all this stuff to my patients. This is where I am at the moment, Sarah. And I'm at a place where my work is still outpatient, which I enjoy because it gives me the flexibility to see my kids later on and spend time with them. And I could also focus on my speaking and writing work. So I think it's evolved. My practice has evolved to a point where it's allowed me to have work-life integration. I don't like the word work-life balance because it's like climbing a mountain that will never reach the top kind of thing. Yeah, so I think, and also these days, as you are aware, that electronics charting, I work in different public hospitals, so they have different charting technologies, and it's getting better. I guess with AI, it's also getting better. Not that hospitals are doing AI yet. They're far from it, but in private practice, we're already implementing AI in our practice, and that's helped so much with burnout rates in my colleagues and myself. So that's where I'm at. I'm in a good place. I think AI people are a bit scared about it, but I think it's got a huge place to play in our clinical efficiency and sustainability. Very important, not burnout.
Yeah. Okay. So let me ask some follow-up questions.
Yes.
So when you went to the US and you were talking
Yes.
about doing the physical rehab, but they also implemented mindfulness, was it the team and the program that was implementing mindfulness and psychology alongside rehab, or was that something you were doing or knew that you needed to do to be able to do the physical part?
I think it wasn't an intentional part on both sides, myself and my trainers. I think it's something that the observations and learnings I got out of my experience there we didn't have psychology at all. We didn't have mindfulness sessions per se. But what I was doing, the task at hand that the trainers asked me to do was mindfulness, basically. It's mindful movement of
Yeah.
greater aerobic capacity, because that's what I had to do. I had to push
Yeah.
tables, go on the treadmill, and yeah, all
Yeah.
that fun stuff that you get to do when you're learning to walk again. Yeah,
Okay.
so wasn't intentional, but it's a huge part of the pain management programs that I supervise. We do a lot of
Yeah.
actually we do way more top down than bottom up, which I'm still trying to convince my
Mm.
colleagues to integrate a bit of both. But because obviously we have psychologists in our team, so there are more top down approaches like CBT, ACT, and all that. But yeah, in that time, no, it was just because I was just how I felt, the learnings I did, and yeah, so
Mhm.
that is based on my observations. We didn't do any formal sessions per se. Yeah.
Yeah, that's what I was curious about. So it sounds like the
Mm.
trainers, so one, you've self-selected to go into this intensive program. So already your mind is, I am going to achieve this. You've got that
Yeah.
determination. So I guess there's some already level of, I'm doing this and it's going to work mindset
Yes.
shift about going into this program. Unless somebody paid for you to go and then you're just there without that internal determination. But you've been in Australia, you've looked at this program and said, that is the program for me, and that is the one that's going to work, and away you went. But then I hear you say that the trainer said, I need you to stay right in this moment. This is going to be really hard, and I need you to do it. And that was that purposeful stay here, stay present, and be here, not there, not behind you, not forward, but right here with me. And we're going to do something really hard, and you're going to fail, right? We're going to do this, we're going to do it. It's going to be really hard, and you're not going to do what you want to do today.
Exactly. I think the most important thing, one of the most important things I have gotten from that interaction with my trainer is what their immense belief in my ability to walk again. I didn't get any
Hmm.
of that in Australia. In fact, that was
Yeah.
probably the primary reason why I went to America, because I didn't get
Yeah.
any of that love or whatever you
Right.
call it. But there's this thing called Pygmalion effect in psychology,
Right.
medicine,
Yes.
where if someone could be a teacher, in fact, could be a if all of us are like both of us are like older consultants or specialists, if we believe in our junior staff, medical staff, they will feel like they can do whatever, they can do it, they can achieve what they want to achieve. Exactly, that's called familiar effect. My trainers had
Yeah.
immense belief that I could walk again, and I then believe, oh my gosh, they believed in me. I need to believe in myself. I need to do this, and that's it. That was it. That was the turning point, mindset shift for me, in terms
Yeah.
of like how I started going down this, it's momentum of just walking and
Mhm.
relearning how to walk. It's fantastic. And I think we cannot underestimate how important the Pygmalion effect is in our society, in our culture, in our environment.
Got it. Okay. So that now helps me understand even more. That is the role often that I've seen in mentors and coaches is, I'm going to believe that you can make this impossible thing come true. I get to hold that belief for you until you also can believe it and walk towards it and make it happen. It's what we do in medicine. Some of us, we hold that hope for our patients that they can do it if they want to. We're just
Exactly.
going to
Same.
we're the cheer squad, and we've got maybe some of the tools to help them, but they're the ones who are going to have to do the hard work. Okay, so that shifted obviously what you were doing as a rehab doctor in Australia. Now
Mm.
you went to the US, you saw this different approach. Did that change how you approached your rehab with your patients when you got back?
Yeah, I think that's when I understood about what the Pygmalion effect was all
Hmm.
about. So I'm always like like you said, a cheerleader for my patients, because by the time they've come to see people like pain specialists like myself, they've given up because everyone's
Hmm.
told them they can't do it. It's all in their head. Why
Hmm.
bother and all these things? So I think it's that believing in them that they could actively manage their pain. So that's it. Really evolved my clinical practice, because if the trainers could do that for me, I could do that for my patients too. And that's what that shifted everything, made my medical career so much easier to sustain in a way,
Hmm.
because I don't have to keep arguing with the patients. I see that in my colleagues, and I'm like, why are you guys doing that? That kind of thing. And family meetings don't have to go pear-shaped. It can be pleasant. It can be encouraging. It can be supportive. It just made my rehab and pain practice so much more fulfilling and meaningful for myself. And I think, that's really crucial. And I guess the good thing about being in a specialty like pain medicine, we're allowed 60 minutes without patients, initial consult. And that's a good chunk of time for patients to be seen, heard, and express themselves, because a lot of them get only 10 minutes, 20 minutes. And then surgical consults are even shorter, like 5 minutes. I don't know. It's shorter.
Yeah.
And they just feel like they've been cut off or whatever and all this. But so I think ultimately, it gave me the compassion and empathy to understand, because I really understand where they've come from, where they're coming from, based on my, I guess, experiences as a patient. So I think it's really evolved my practice to be more compassionate, more fulfilling, more collaborative, rather than talking down at patients.
I expect that you probably also ask them, what are they wanting to achieve? What is their goal for themselves, so that you can help frame that for them and also become that cheerleader perspective for them.
Yeah, and a huge part of our pain management programs, at least the ones I run in private practice, one of the first few questions we ask our patients is, what do you want to do? What do you enjoy? What do you love? We call that graded activity. So it'll be, some of them will be, I just want to spend time with my granddaughter, have a cup, and then take her out for a meal. That was it. And that's a meaningful goal for them. It doesn't have to be, I have to walk like 500 meters a day. That's a meaningful goal. A lot of them do want to just get back to what they used to enjoy, the time and the kind of activities they did with their family and all that. So I think really crucial to ask the patients what they really love, what are meaningful goals for them, and always establish that at the very beginning of the consultation. I think it sets the scene, makes the patient excited about the program, about what they can achieve because I think it's about helping them see the future vision of themselves, what they're like after the program. And that's what we do. We do a lot of values work with them, or my colleagues, the psychologist colleagues do. And then we get them to envision what it'll be like when they achieve the goals at the end of the program. So gets them excited about the program, because the program is not for the faint-hearted. It's like 4 weeks of pre-program, which is like they have to come into clinic a few times a week. And then the actual group program, they have to come almost every day. It's a lot of commitment, and it can be quite scary for them. Oh, I gotta come all the way to the clinic and do all this stuff. Will I even get better, and will I improve? And can they even help me? Because no one could up to this point, of course, and all that. So all of that.
Now, I see the potential for physician burnout when you are setting yourself up as the only or the primary cheerleader for this patient. Okay. Were you able to now pass that? Could it be a collective cheerleading with the team rather than you, the physician, with the patient? That connection obviously can cause you more burnout as a physician if they're coming to you for that keep going encouragement. How did you use your wider team? Was that something that you thought of as part of your burnout or as part of your setting up this program?
Yeah, I had to learn that the hard way, because when I first was a newly minted pain physician, I took on everything. I took on public work, I took on private practice, I took on solo practitioner work, which is that's the high risk of burnout. Is the solo. You're right, Sarah. You rightfully pointed out solo practitioner work is a major cause of burnout, and that's what happened because there was no, I guess, collegial support or collaborative support from your other colleagues. So I had to amicably resign from a few workplaces who didn't, which I felt that I was just solo practicing away, working away solo on my own. I didn't like that. So I stayed on with the current workplaces where we've got a multidisciplinary team. And I think some conditions like chronic pain it needs a multidisciplinary team management. And you're right, we share the love amongst us. And I think when one of us is down, the others can step up and support. And we all have different strengths. Like medical people, we've got certain strengths, but we're not an OT. We don't know return to work functioning things. Physios have a different approach as well. They're more pragmatic usually, and very practical people. And then my team is quite huge. We've got dietitians, social workers, addiction medicine specialists, of course. We do as psychiatrists, absolutely vital in a pain clinic. And we are big clinics. So both of my private and public practices are quite robust in the way that we've got a huge team and we need that support to support each other and to look
Mhm.
after, to put our patient as our like focus, but also meaning that we have to support each other, especially when one of your colleagues is going through burnout. You got to keep look out for each other too,
Absolutely.
because
Yeah.
it burnout can be so lonely, which I had to go through in
Yeah.
2019.
Totally. And I hear you say I was a solo physician within a group practice because we see this a lot. You do somewhat work in isolation, but there's a skill set to learn to be able to teach a team that collective understanding that we are collaborative with our patients, we
Yeah,
cheerlead our patients, we want their goals to be the thing that we encourage them toward. Because if you have a big team, but some of them are, why you want that, dear patient? That's not realistic. And the other half of the team is saying, go get it, go make it happen that you can go out for dinner with your daughter. That's not going to work very well either.
no, it's not. Yeah, that's why we have case conferences to make sure that our expectations and what we are working on with the patient are aligned with one another. And yes, arguments happen in case conferences because all different human we are all human beings with different nervous systems and
Yes.
different beliefs and all and upbringing and all that. But we will definitely we usually come to some kind of resolution. What we want is what we think is best for the patient. And of course, we
Mhm.
will also still collaborate with the patient and make sure that we are on track with them. I think that is a successful pain management program or successful medical career. It's when you have
Mm.
collaborative conversations with your patients. That's when you know that you've hit the sweet spot in a way of your medical career and able to sustain your work performance without burning out. I think that's key because burnout is so real these days and it can just happen insidiously, which I experienced in 2019.
Yeah. Let's talk about goals and collaborativeness for physicians with burnout. So if
Yeah.
you're a physician in burnout and you're told just go breathe, just go meditate,
Oh gosh,
how
yes.
did you identify what you wanted, what the goal was you wanted that was different from where you were? So where you were was not working for you. Who helped you? Or was it just internal? This is what I want to create about my career. This is what I want to create that would make it easy to return to work and stay in work. Who collaborated with you to say, what do you want, Olivia? And how do we get you there?
I so if I recall in my 2019 burnout journey, I just want, as obviously as a healthcare professional, I want to understand more about the condition. That's the first thing I want. That's what I did with my spinal cord injury. I just wanted to know what a spinal cord injury was. I knew, but
Yes, yes,
intellectually, but I didn't know what I had to go through personally and
yes.
physically and all that. So what I did is I reached out to another GP, Dr. Amy Ims, who was a GP in Tasmania who already specialized in helping not just doctors. I think she helps other non-medical people go through burnout. So I reached out to her and say, "Hey, can I ask you for some resources? Do you have a some kind of book?" I think she had a book at that time. So what she did, she sent me the book and with lots of other resources. That was the first thing. And as I read the book, I went, oh, so burnout is not just exhaustion, huh? There's many other things. And that's how I knew. Started knowing it's not just exhaustion, it's about deep, just losing connection with yourself and other people. Is when you
Mm,
lose life purpose. Like you don't, some doctors eventually reach that point where loss of self-efficacy, loss of self-belief. They want to quit medicine. They want to, because they're so burnt out that they want to open a cafe, not realizing that opening cafe will also will cause burnout in a
yes,
different way. But
yes.
yeah, they want to do other stuff other than medicine. I think yeah, so it's quite interesting that I learned about how to recognize burnout and what to do about it. And she gave me lots of different ideas how to manage it. Probably see your GP first and make sure that you're actually okay. And then secondly, work on slowly getting out there. I will say just the fundamental strategies, but there was nothing about nervous system like
Mhm,
regulation things. In fact, I think it was very cognitive. It's, oh, do this, do that, have a
mhm,
cup of coffee with friends. I'm like, but I'm so burnt out, I don't even want to have a cup of coffee myself, let alone
mm,
my friends. Like, but I
yeah.
realized that nervous system work needs a lot of doses, like little doses of, we call it titration in a way. And we don't have to attack it straight away with a big dose going, oh, you got to do all these things. You got to go out and like go for a run. And I'm like, oh, I don't even want to get out of the house. I'm still in my PJs at 5 p.m. And anyway,
Yeah.
that kind of thing. So I think, yeah, it's a self-realizing journey. So I had to look into other ways, not personal development tools. So I
Mhm.
started being interested in a lot of people like Tony Robbins. Tony Robbins is always a good start for many people for personal development. And then that's I looked into his stuff. That what really helped me was I got a mindset coach for myself. I think that was my first investment in I've never had a coach for anything. In
Mm.
fact, with my returning to walk again, I had to coach myself. I don't know what coaching is. I thought that was coaching to me. So I got a mindset coach to help, which really helped because some of the tools she used was nervous system work, which was really
Mhm.
handy. And I think that was the key turning point for me. Always invest in coaches and mentors, whether it's for personal development or business or whatever, spiritual and things like that. Worth investing. That's what I did. I started investing in coaches and mentors over the last 5 years, and it's helped me tremendously. Because I have to say that my coaches and my mentors are also on my team in a way.
Yeah, that's right. We're setting up that. Here's the goal I want to achieve. I need a cheerleader who can absolutely believe in me when I feel like I'm in the pit of despair, and they can keep being that encouragement and support as I have to do the hard work of getting there to that impossible goal
Yeah,
of what I envisaged for myself.
yeah. And I think the future vision of myself, because what led me to actually get help from burnout was when I didn't know I was burning out until I was burnt out, basically. And I think a few months leading up to the actual exhaustion collapse, all that, whatever you want to call the episode, I have to. This is something that I'm still working on sometimes on shame and guilt about because my son was only 3 at that time. He was really young,
Hmm.
and every time I come home, I have no capacity, no resources for him. I'm
Hmm.
tapped out basically, and he will want to show me his drawings. He wants to talk to me about his day in daycare, kinder, and I'm just absolutely not interested. Just don't talk to me.
Hmm.
I'm so tired. And
Hmm.
then one day he just wanted to show me his drawing. He was very excited, and I went, I'm excited. No, I'm so tired. I have to go and send this email to work. And that was like 7:30 p.m. And then he just looked at me with those eyes and said, kids are sometimes really blunt. And he goes, Mommy, do you still love me? And then I went, Of
Oh,
course I do. And I went, Oh. And that's when I knew I
yeah.
messed up. I got to get this right. That's when my inner knowing went, Oh, I got to get help. Or else my son will hate me when he's 20. And you see
Yeah.
those in Hollywood anyway. Anyway, all those, oh my gosh, and you're like, oh, I don't want that. And yeah, that's when I started getting help for burnout, or motivated me to push me to
Yes.
get help for burnout because I could just go on and just
Mm.
go on and push through until I
Yeah.
collapsed. But I didn't want to kind of
Yeah.
go that all the way there. I just want to get help
Yeah.
about it. So I think that kind of sparked everything.
Yeah.
Mm.
Yeah. Oh, that's a painful and so heartfelt part of your burnout story. Yeah.
Yeah, very. I think it's still up to this day. I look at him and go, I hope he doesn't remember that, but I think he remembers.
At the same time, he probably helped save you and your career,
I
right?
think he
By
did.
saying that, being like, Mom, do you even love me anymore? And you're like, okay, there's a powerful, now I have insight into just how much of myself I've lost. If my
Exactly.
kid has to ask me that.
Yeah,
And
exactly.
using it as that stepping stone towards, I'm going to make this right, kiddo, you watch.
Yeah, exactly. And I did. So I'm grateful for the mentors and the coaches who have helped me through. Very grateful. And I think I tapped into community very early on as well. So I just want to find out other burnt out physicians like myself. That's what I did. And that's how I found this huge community of US based physicians. And I got
Yeah.
my first burnout coach, Dyke Drummond. I
Yes.
think he does retirement stuff now. But he was he
Yeah.
helped me a lot through my burnout because
Yeah.
he's like the happy doctor, happy MD.
Happy
And
MD, I think is his brand.
and
Yeah.
then I was like, I just want to be happy MD. Not him, but
Yes.
I just want to be happy as well. And then that's how it
Yeah.
all started. A good working
Yeah.
relationship. He's helped me through it was great. He had retreats and everything, and I really enjoyed those retreats. Except that it was 1 a.m. Australian time, which I didn't enjoy,
Yes.
but that's okay. I don't know if I showed up at 1 a.m. like going, hi Dyke. Half asleep, but that's okay. Got through it in the end. Yeah,
Yeah, like you said, the recovery is not ever easy. The
mm,
path of change is not easy. And we need someone believing in us that we can make this happen in order to be able to
exactly.
do the hard of change so we can get to where we want to go. So that encouragement for us listening that if we're feeling a shell of ourselves, if our kids asking us if we even love them anymore, if we have that insight that this needs to change, it's going and connecting, finding community, finding a mentor or coach, a cheerleader, someone who can really help you figure out what do you want, what do you need to do to get there, and be that support as you do the hard of change.
Exactly.
So important, so important. I think this is really helpful. What does it look like today when you're recovering from a spinal injury in terms of what time investment per week do you have to put into looking after your physical body? Because I know that we're
Mm,
told you got to look after your body, you got to exercise, you got to move. And as busy physicians, we're like, yeah, that's great to hear, but I got inboxes and I've got paperwork. But I think if you're recovering from a serious illness, there's got to be some minimum you've got to meet. What does it look like to be
absolutely.
in your shoes?
Yeah, because nowadays other serious illnesses will include long COVID. There's a lot of
Yeah,
patients, a lot of doctors, other healthcare
yeah.
professionals who have got long COVID. I went through a bout of it myself for 2 years. That wasn't fun
No.
with like postural blood pressure changes and everything.
Mm,
Thankfully, I've got a good medical team looking after me. But
mm,
my spinal cord injury taught me that I still have to maintain things, as in maintain a program. So
mm-hmm,
I try to do to exercise at least four
mm-hmm,
times a week. Once a week, I'll have a Pilates session with my musculoskeletal physio, and it's the
mm-hmm,
same person I've worked with since my injury, and she's in the
mm-hmm.
book as well in my back on my feet memoir. She's very excited that she's in the book, and she's still my physio up to this day. And clinical Pilates was what got me through in Project Walk because
Mm-hmm,
my trainer Mika knew she's very good with Pilates stuff, and we did a lot of
mm-hmm,
reformer work, and that was a way I could strengthen my muscles because I will be using the reformer, and there will be no gravity because I'm not lying straight out, I'm lying flat, so there's no gravity,
mm-hmm,
and you can adjust the springs and everything. So that's one. So Pilates is for flexibility and balance and all this. Secondly, some kind of aerobic exercise. This one is the one that we all know. We got to do 20 minutes or 30 minutes a few times a week.
Yep.
And yes, I do that. I do that. I have an exercise class that I do with a group of people like
Mm-hmm,
myself. Not all of us have spinal cord injuries. There'll be some with MS, some with stroke. So
mm-hmm,
we just
mm-hmm.
hang out together and exercise as a group. And then that is fun as well. Gets a community vibe. So that's one. And then thirdly, I have my own personal trainer with my trainer Philippe. He used to work at Project Walk 15 years ago. He was a young apprentice at that time. Now he's a lot older like me. So we talk about the past, but we also will focus on the present, and we work on my nervous system, like the nervous system to get it going again
Mm-hmm.
physically. So there's a thing about getting nervous system physically and also doing a little bit of embodiment work. That's a totally different thing. And then the fourth person that I work with, just thinking, oh gosh, I work with so many people. I'm losing track. Oh, hydrotherapy. That's it. I'm just like, what else do I do? That's right. I do hydrotherapy as well once a week with a program set up by
Mm-hmm.
my physio. That's it. And then
Yeah.
I try the pool therapy is really helpful. There's something about the water. There's some people love swimming, and a lot of my patients who do hydrotherapy, they improve very quickly, like progress wise, like managing their chronic pain flares, just
Mm-hmm,
because they said in the pool they just felt so free. They could do all
mm-hmm,
the exercises. They feel like themselves again, and all those things.
mm-hmm,
I felt a lot of that as well in my early days, and I wrote about it in the book how I felt
mm-hmm.
about hydrotherapy. In fact, I think my book is number one bestseller in physical injuries and rehabilitation. Funny enough, even though it's a memoir, but I
Mm-hmm.
just realized it's neurological rehab in storytelling sense.
That's right. This is it. You're
Yeah,
telling us
yeah,
all the good things to do for rehab, but from the
correct.
perspective of you as the patient. But
Exactly.
yeah, yeah, so fascinating. Thank you for that
Yeah,
because it helps us understand that even as busy physicians, when it matters, like when your body's function relies on it, you will make the time to get all of your 4 or 5 classes in each week, no matter what.
exactly.
Whereas if you are potentially able-bodied and you don't realize you can go years without exercise. And I see
Right.
that in the positions I look after is I'm too busy, it'll have to happen later, You've got a ancient machine here that needs to be looked after. Our body needs to keep us going well into our 80s to 100.
Exactly.
We are obligated to look after it too for our,
Exactly, exactly.
for
And
our
I think
sustainability.
yeah, yes, exactly. Just not just physical sustainability, mental, emotional sustainability. And I
Mm-hmm.
think as we grow older, we even need to do that more. Especially as us women, we have perimenopause. That's all. It
Mm-hmm.
adds a lot of different flavors and
Mm-hmm.
challenges to everything. So I think,
Yes.
yeah, and you're right. The human body is, we need, it's a vessel for us to do lots of great things on earth. So I think
Mm-hmm.
we should do do justice and help maintain it or help improve it. We give this advice to patients. We need to preach,
Yeah.
do it ourselves. I'm guilty of it because I do that and sometimes I don't do it either. But but most times I do my exercise regime. But sometimes
Yeah.
when things are busy, I agree. I can slip. I can just
Yeah.
neglect it for a week or two, and I can feel a difference once I neglect
Mm,
it. I'll start to be
yeah.
slower in my walking. I'll be tired all the time, drinking lots of coffee. That's when I knew. Not sleeping well. I went, oh, the nervous system is getting dysregulated again. Here we go.
Mm,
It's a learning to recognize early warning signs of a dysregulated nervous system,
yeah.
which can include like
Yeah.
the restlessness, not being able to sleep well, drinking lots of coffee, push
Mm-hmm.
through. That could be a
Mm-hmm.
starting, or that at least was my starting symptoms or warning
Yes.
signs. Yeah, everyone's
Yes.
got different barometers, so everyone's got different signs.
Yeah. Yeah. How do people find you if they're looking to connect with what you're doing or read your book?
Absolutely. You can find me on Instagram under Dr. Olivia Ong, the heart-centered doctor. That's the best way to reach out to me on Instagram.
Mm-hmm.
I've got a website as well, drolivialeong.com. And if you want to purchase my book, you can head in there and purchase my book. There's some options. You can choose to either get a personalized and signed copy from me, or I'll give you a choice of booksellers in Australia that you can choose from. And my book will be actually released in the US on the 19th of May. So look out, the US based physicians. My book will
There
be
we
out
go.
on the 19th of May and in the UK on the 13th of August for the UK based ones out there. Yeah.
Beautiful. Thank you so much for this conversation, Dr. Ong, and thank you so much for sharing your story with us.
All right. Thanks for having me, Sarah. Thank you.
You're welcome. Bye, everyone.
Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have Charting Champions for physicians and Smarter Charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.